You remove rice, pasta, potatoes, cereal, sweets, and most fruit. Then something unusual happens. Your body starts using a different fuel system. This is the promise behind the ketogenic diet. Some people treat keto like a metabolic cheat code. Others treat it like an excuse to eat unlimited bacon and butter. Both versions miss the point. Keto is not magic. It is a tool. And like any tool, it works well for some jobs and poorly for others. Keto is short for ketogenic diet. It is a diet low enough in carbohydrates to push your body into a state called ketosis. Most beginner keto diets limit carbohydrates to around 20 to 50 grams per day, but that number is not a law of nature. Some people begin producing ketones at a higher carbohydrate intake. Others need to go lower. A strict standard ketogenic diet often keeps carbohydrates close to 30 grams per day or below. That means your food choices change quickly. Bread is out. Rice is out. Pasta is out. Sugary drinks are out. Instead, meals are usually built around foods like eggs, fish, meat, olive oil, avocado, nuts, cheese, and low-carbohydrate vegetables. But what is your body doing with all of that fat? Your body normally runs on a mixture of fuels. It uses carbohydrates, it uses fat, and under certain conditions, it also uses protein. When you drastically reduce carbohydrates, your liver's stored carbohydrate supply begins to fall. Your insulin levels also decrease. This allows your body to release and burn more fat. But there is a problem. Your brain cannot use fatty acids directly as a major fuel source. So your liver converts part of that fat into molecules called ketones. Your brain and other tissues can use those ketones for energy. That shift is called ketosis. Nutritional ketosis is not the same thing as diabetic ketoacidosis. They both involve ketones, but diabetic ketoacidosis is a dangerous medical condition involving uncontrolled ketone production and changes in blood acidity. Why does the scale drop so quickly? This is where keto often looks more dramatic than it is. When your body stores carbohydrates, it stores water alongside them. When your carbohydrate stores shrink, some of that water leaves your body. Ketosis also increases water and electrolyte loss. So during the first few days, the number on the scale can drop quickly. But much of that early change is water, not body fat. And the reverse is also true. Eat carbohydrates again, and your weight might rise noticeably within a day or two. That does not mean you suddenly gain several pounds of fat. Your body is restoring carbohydrate and water. This distinction matters because weight loss and fat loss are not the same thing. Does keto burn more body fat? Keto makes your body burn more fat for fuel, but this does not automatically mean it removes more stored body fat. Imagine pouring more fuel into a fire while also trying to empty the fuel tank beside it. If you eat more fat than your body needs, your body has less reason to draw heavily from its own stored fat. To lose body fat, you still need an energy deficit. Keto can help some people create that deficit without obsessively counting every calorie. Why? Partly because the food choices are limited. There are fewer snacks, fewer desserts, fewer easy-to-overeat foods. Many people also feel less hungry. But the exact reason is more complicated than simply saying ketones switch off your appetite. What about protein? Protein matters on keto. Too little protein makes it harder to protect muscle during weight loss. But keto is not supposed to be an unlimited protein diet either. Protein needs to be high enough to maintain muscle, but the diet still needs to stay low enough in carbohydrates to support ketosis. This is one reason a carefully planned keto diet looks different from eating bacon, cheese, and butter whenever you feel hungry. Food quality still matters. A diet built around fish, olive oil, avocado, nuts, eggs, and vegetables is not the same as a diet built around processed meat and saturated fat. Lyle McDonald separates keto into three main versions. The first is the standard ketogenic diet, or SKD. This is the version most people imagine, consistently low carbohydrates every day. The second is the targeted ketogenic diet, or TKD. This adds a controlled amount of carbohydrates around workouts. The third is the cyclical ketogenic diet, or CKD. This alternates periods of ketosis with planned higher carbohydrate days. Why add carbohydrates back in? Because strict keto is not ideal for every type of exercise. Walking and low-intensity activity are one thing. Hard weight training, sprinting, and intense sport are different. Your muscles often perform better during high-intensity work when they have access to stored carbohydrates. Does keto have real benefits? Yes, in the right context. The ketogenic diet has a long history as a treatment for certain forms of epilepsy. Researchers have also studied low-carbohydrate and ketogenic diets for weight management, type 2 diabetes, and metabolic health. Some people lose weight and improve certain blood sugar markers. But keto is not the only diet that works, and it is not automatically superior to a balanced diet with more carbohydrates. The best approach depends on your health, your training, your food preferences, and whether you can follow the diet for more than a few weeks. Who needs to be careful? Keto is not a casual experiment for everyone. People using diabetes medication need to be careful because lowering carbohydrates can change blood sugar levels and medication needs quickly. This is especially important for people using SGLT2 inhibitors. Pregnant people, people with a history of eating disorders, and people with certain liver, pancreatic, kidney, or fat metabolism conditions also need individual medical guidance. A therapeutic ketogenic diet for epilepsy is also different from a typical weight loss version and requires clinical supervision. So, is keto the best diet? No single diet deserves that title. Keto works well for some people because it gives them structure, reduces hunger, and helps them eat less. For other people, it feels restrictive, hurts their training, and turns every social meal into a negotiation. The real question is not whether keto is good or bad. The real question is whether keto fits your goal, your body, and your life. Because the best diet is not the one with the most dramatic first week. It is the one you can still follow after the excitement wears off. But there is one final mistake that almost nobody talks about. People often assume that the goal of a ketogenic diet is to produce as many ketones as possible. They buy urine strips, chase darker colors, add more fat to their meals, and treat a high ketone reading like a high score. But a ketone reading does not tell you how much body fat you are losing. It only tells you something about ketones being produced or excreted at that moment. Lyle McDonald makes an important distinction in his work on ketogenic diets. Ketosis is not what causes fat burning. It is largely a consequence of increased fat oxidation. Your body releases fatty acids, the liver converts some of them into ketones, and those ketones can then be used as fuel. The order matters. Fat burning can produce ketosis, but producing more ketones does not guarantee that more stored body fat is being burned. In fact, you can raise ketone production by eating more dietary fat. Add enough butter, oil, cream, or medium-chain triglycerides, and your ketone reading may increase. But now your body has a fresh supply of fat coming from food. It can burn that incoming fat instead of pulling as much energy from the fat stored on your body. So a person can have a dark ketone strip and still fail to lose body fat. Another person can lose body fat without ever seeing an impressive reading on a urine strip. Hydration changes the concentration of the urine. Activity levels affect ketone production and use, and urine strips measure ketones leaving the body, not the full metabolic picture inside it. The absence of a dark reading does not automatically mean the diet has stopped working. This also explains why a ketogenic diet designed for epilepsy is not the same as a ketogenic diet designed for fat loss. In a therapeutic diet, producing and maintaining a specific level of ketosis may be part of the treatment itself. That can require a very high ratio of fat to protein and carbohydrate. But when the goal is body composition, forcing that same ratio can create a problem. If fat is pushed extremely high, calories may become too high for meaningful fat loss. If protein is pushed too low to preserve the ratio, muscle retention may suffer. For a person trying to lose fat, the priorities are different. Protein must be sufficient. Total energy still matters. Training should help preserve muscle, and dietary fat should be treated as fuel, not as a target that must always be maximized. That may be the most useful way to understand keto. Carbohydrates are limited to create the metabolic environment. Protein is set to protect lean tissue. Fat fills the remaining energy needs. If fat loss stops, the answer is not automatically to add more fat or chase a darker ketone reading. Sometimes the better move is the opposite. The real scoreboard is not the color of a test strip. It is whether body fat is decreasing, muscle is being maintained, hunger is manageable, performance is acceptable, and the diet still fits your life. Ketosis is a metabolic state. Fat loss is an outcome. Confusing the two is how a useful tool becomes another diet myth.